dietitian. I work at the Student Health Center here at LSU, specifically in the Department of Wellness and Health Promotion. I also am one of the providers on the eating disorder treatment team. I've been a dietitian for 14 years, and I have been with the Student Health Center for almost 5 years. And I'm going to let my colleague introduce herself.
Hello, everybody. My name is Crystal Loop. I'm a wellness coordinator in the Office of Wellness and Health Promotion with Emily here in the Student Health Center. I do general wellness coaching sessions with students, but I also work primarily in the Lighthouse program, which is the university's interviolence prevention support and advocacy program. I love Lighthouse, so that's definitely near and dear to my heart, but I'm really excited to also be working on this body image project with Emily. I have been at the Student Health Center for a little over 1.5 years now, and I also have experience as a counselor or therapist in the community. Next slide, please. So Emily and I are both housed in the Office of Wellness and Health Promotion in the Student Health Center. And the Student Health Center is located on Infirmary Road past the School of Music near what used to be Nukes and Inga's and the Enchanted Forest. We have 3 service areas in the Student Health Center: our medical clinic, our mental health service, and wellness and health promotion. And we're currently offering both in-person and telehealth appointments to students. So we encourage you to check our website for the most up-to-date information on our services at this time. Next slide, please. Before we get started in our discussion about body image, we do want to give a trigger warning today. We'll be doing this for each part in our series. We are talking about body image, which for many of us can be a distressing topic. We're going to be talking about weight, body shape and size, as well as eating disorders. You may also hear words like fat or thin in our 3-part series, so we want to make note of that for you. We also want to bring to this discussion our own personal lived experiences. Emily and I, as clinicians, each have our own unique experiences of living in our bodies and our own personal body image development. So to speak to my own, I am a Middle Eastern cisgender female, and I live in what I consider to be a larger body. In my own life, I've experienced times of discomfort in my body, and I've experienced times of greater self-acceptance.
I, Emily, am a white cisgender female, and I live in what I consider a smaller body. I sometimes experience discomfort with my own body image and also times of increased acceptance, and continue to work towards ongoing acceptance.
Same here, ditto to that. And so as we've just briefly discussed our own lived experiences, it's important that we talk about how our personal privileges and biases, we may have them for our own reasons and they may impact our work. So while I live in a larger body, I still do experience privilege because of my size, shape, and mobility. And while I identify as a person of color, I also do experience light skin privilege and have had the experience of passing as white. So these types of privileges, which I'm bringing up in myself and that exist in all of us, if left unchecked and untreated, can contribute to biases and assumptions that exist among all humans, but especially clinicians and professionals who are in the helping field. And so we are aware of that, and we want you to know that we're aware that this exists in the medical profession and in health professionals, as well as nutrition professionals and other health care clinicians. And some of these biases that we want to talk about are gender biases, racial biases, weight bias, and more. And these can really get in the way of us providing accurate and helpful treatment and having really healthy and vulnerable discussions with folks. So it's our hope that as we've exposed some of these biases and privileges in ourselves, that you will also consider some of your own and contribute some of your thoughts on this. We'll have time for some questions likely at the end, but we'll also leave our contact information on the last slide for you so that you can reach out to us if you want to discuss any of this further.
Thank you so much, Crystal. It's so well said. So I'm just going to do a quick little review of the objectives. As I mentioned, this is part one of a 3-part series, so we do hope that you join us for the following parts of this series. But today we're going to discuss just some basics about defining body image, the relevance that body image has in our lives, teasing apart the difference between body image dissatisfaction versus a body image disorder or dysmorphia, and a little bit about how body image develops over time, some common dilemmas, as well as the impacts of COVID-19 on body image. We're also going to provide some resources for self-assessment and just some resources overall.
Excellent. So we'll start the discussion today with defining body image. And as Melissa said at the beginning, please feel free to raise a hand, show your face, unmute yourself, or submit a question or a contribution in the chat throughout this discussion. We do want, this to be a conversation. So body image is defined as one's thoughts, perceptions, and attitudes about their physical appearance. Body image is a subjective experience, meaning that how you appear on the outside to others may not necessarily match or reflect how you think and feel about yourself and your own body image. So body image is all about your own thoughts, feelings, and attitudes about you. Body image refers to how you personally experience living in your body. One way you can start to figure out what that experience is like for you is to consider how you see and feel about yourself when you look in the mirror. How you respond to that question and what you think about yourself might tell you a little bit about what it's like actually living in your body. Body image is also complex and multifaceted. This is not a simple topic, and we could probably do infinity parts on this project. Your body image is influenced by an infinite amount of factors over the course of the lifetime. It's ever changing, and it can even fluctuate from what seems like day to day or moment to moment. Our goal with this program is to help identify some of the factors that influence body image and to help you begin to stabilize a more healthy or balanced body image overall. Next slide, please.
Okay, so we think it's really important to promote healthy expectations, and this series is not adequate enough to meet all the needs of body image healing, but it can be a starting point to understanding some basics about body image, exploring potential problems or obstacles, and the introduction of some tools to begin working towards a healthier body image. So as Crystal mentioned, there is just an infinite amount of influence that, that can be had on body image. So with that in mind, body image is a long distance race. This is not a sprint, and it can take anywhere from 18 to 24 months or longer to change our thoughts related to body image. I know for myself as a provider in the eating disorder world, so to speak, sometimes I have clients that really want to fix these problems really quickly. And unfortunately, especially with something as complex as body image or eating disorders, it really takes a lot of time to make changes there. So I cannot highlight enough having these expectations set out front, outright, that, we're not going to make really rapid changes to these really complex matters. It's going to take some patience and time.
And can I interject something real quick on that? So Emily, I think you brought up another point, which is something that we want to talk about in this series. Our goal in providing Body Talk is not to help you get a quick fix as far as like changing your appearance. We are not here for that. We want you to experience greater satisfaction with your body, whatever that means. If that means making changes to your appearance, then great, so be it. But if that doesn't mean that, our hope is really that you can do the work on what it takes to actually feel better in the body that you live in.
Thank you for adding that, Crystal. Yeah, and in talking about some of these expectations, we also found it really important to mention we will not love our bodies 100% of the time, and that's okay. And we're going to talk a little bit more about that later in the presentation, but sometimes I feel like when we hear having a positive body image or a healthy body image, that means that we have to love our body all the time, 100% of the time, and that's just not realistic. So this is our chance to like explore some of those healthy expectations. And then also a little bit of what Crystal touched on, you know, we might have a goal of wanting to lose weight, but we can also have body acceptance at the same time. So the two don't have to be so enmeshed. They can be separate pieces. And I just absolutely love this quote, and I want to read it that's on this slide here. It's from a dietitian that does body image and eating disorder work. And Marcy Evans says, "To me, body image work is not about trying to feel positive about how you look. It's about developing a different kind of relationship to what it has been like and what it is like for you to have a body." And I just couldn't say it any better than this or summarize it any better than this, so I just had to read it. It's quite beautiful. And you know, and moving on from talking about expectations, we wanted to talk a little bit too about the relevance of body image. You know, body image can influence so many things in our life, including our eating patterns, our mood, our overall well-being. And we also found a body image study that found that college students showed 46% of participants had some degree of body image discontent or difficulties. So it's definitely relevant for the college age population, but I think it's probably relevant for anybody that has a body. So that being said, we know that chronic unhealthy body image can leave us vulnerable to developing other unhealthy coping mechanisms. And, you know, one of those things could be disordered eating or eating disorder, which is also relevant here. So a quick statistic, 30 million people in the US will struggle with a clinically significant eating disorder at some point in their lives. And really just simply put, talking about our challenges with body image can help improve body image, which in turn could reduce the chance of turning to disordered eating habits.
All right, so it's important that, again, in part one, we take note here that having body image issues does not necessarily mean that you have an eating disorder or another diagnosable disorder like body dysmorphia. In fact, body image issues and feelings of dissatisfaction or distress are very common, as Emily mentioned. So we've kind of made this comparison to help distinguish the differences between experiencing body dissatisfaction, which still may cause a lot of distress, and then some of the criteria for disorders in the DSM-5, which is a diagnosing manual. So relating to one bullet point on the right under disorder does not necessarily mean you have a disorder, but if you notice that you're relating to a few or all of the bullets on the right, you may want to consider seeking some additional professional support or at least more information, and we'll provide some of that to you at the end. So we'll go to the left-hand side first. Body image dissatisfaction may involve concerns or complaints about weight as primary issues and feeling unhappy with your physical appearance, possibly the size or shape of your body or specific physical characteristics. Body image dissatisfaction can also contribute to increased anxiety, feelings of shame or self-consciousness, particularly in social situations. It can also contribute to decreased self-esteem and an overall negative or distorted body image. And when we talk about this term distorted body image, we're talking about having an experience of your own body that does not match or reflect reality. On the other hand, on the right-hand side of the screen, a diagnosable disorder could include things like an intense fear of gaining weight and an overemphasis or preoccupation or even an obsession with perceived defects or flaws that are not observable or may appear slight to others. Other criteria of a disorder could include experiencing significant emotional distress or impairment on a day-to-day basis, as well as having that overall negative or distorted body image coupled with obsessive thinking about your perceived defects or flaws. So again, I'll just reiterate that relating to one bullet on one side, particularly that right side, does not necessarily mean that you have a diagnosable disorder. But again, if you are concerned based on reading these lists, please feel free to reach out to either one of us or seek additional support from a professional with your body image issues. Next slide, please.
Okay, so now for what I call the fun part, the visual stuff. I'm a super visual person, so this really helps me take some of what Crystal said and put it in a little bit more visual sense. So we wanted to provide a visual about teasing apart the difference between body image dissatisfaction versus a disorder. And so rather than focusing just on the number on a scale of our weight, we would like to use this scale to kind of identify body image tolerance, to focus on how much distress our body image might be causing us. So we can compare the impact our body image has on this spectrum and really think about how much time we might be spending in any area on this scale or spectrum. So for example, if we are frequently on the 6, 7, 8, 9, 10 side and really are there very often, that might be an indication that we want to look more at our body image challenges, possibly seek professional support if need be. But it would be considered normal to fall anywhere on this scale at any point. But I think the main takeaway here is how much time you spend at a given point on this scale. And I mean, it would be really unrealistic to think we will never experience distress about body image and be in the no pain zero scale all of the time. But I think when we think about it and use this visual to kind of assess where we are most of the time, it can give us a little bit more clear understanding, maybe where we fall on how distressed we are from our body image.
I love that scale. So why does body image matter? And I just think about what it would be like to be, at a 6 to 10 all the time, and how painful that would be and uncomfortable to live like that. Yeah. So it matters clearly because your body is your home. And it is one of the only things that's guaranteed to be with you your whole life. It's never going to leave you. So, that's the good news about it, right? So because we can't escape our bodies, we also can't escape any distress that we may feel about our bodies at any point in time. And that distress or impairment, it can impact our physical, mental, and emotional well-being. So this body image has big impacts. Body image can also impact our self-esteem. It can increase our worry or preoccupation with our physical appearance in general, where we're maybe putting more weight on our physical appearance than other characteristics or qualities that we may have. And it can contribute to gender identity development. Often, if our physical body does not match our body image ideals, we can experience, again, dissatisfaction, discontent, or distress. Body image can increase or affect social anxiety levels. It can affect sexual fulfillment, bring about eating and fitness disturbances, and it can intertwine with other physical and mental health issues. So now let's talk about how our body image develops. So it's important to note that the cultures and subcultures with which we are a part of and we identify impact our body image development. And there can be different attractiveness values in different cultural groups, which is quite normal. These values are really important to consider as we think about our own personal body image development. This is not to say that we should generalize any values based on a person's cultural identity, but this does help us understand one reason why some people that have similar body types who grow up in different cultures or in different time periods might have different body images and experiences of living in their physical bodies, even if they look similar. So when we talk about body image, we're also not only talking about the size, shape, or weight of a person, we're also talking about things like colorism, or preferring a certain skin color or skin tone over another, other issues related to physical features like body hair, or other hair preferences, and so forth. We also want to note that the LGBTQ plus population is at a higher risk for body image issues. Specifically, trans individuals are at a higher risk for eating disorders due to a very understandable desire for congruence between their physical body and their gender identity and expression. Our relationships with family, friends, peers, they can also affect our body image development for better or for worse. And our personal characteristics or traits, whether that be biological traits, inherited traits, or personality traits, can also play a role in how our body image develops over time.
All right, so I wanted to just take a little bit of time to talk about what a healthy body image could look like. So we've talked about a little bit about what body image is and some of the ways it can be harmful or damaging, or how it develops. But what some other terms I would like to cover is neutral body image and positive body image. So a neutral body image could really just be a clear, true perception of shape and someone that views various parts of their body as they really are. For positive body image, it includes all of those components of the neutral body image, but also includes components of feeling comfortable and confident in your body, accepting your natural body shape and size, and recognizing that physical appearance says very little about one's character and value as a person. And additional ways a healthy body image can benefit us: it can improve our feelings of self-worth. It can assist us with feeling comfortable and confident in our body. Can contribute to enjoyment of closer relationships. I know that with a lot of the clients that I work with and students that I work with, a lot of the obsessive thoughts pull them away from being present in the moment, and therefore they're not able to enjoy their friends or family and just the moment in and of itself. So having a healthy body image can help us to enjoy relationships and present moments. Also, it can help, a healthy body image can help reduce the risk of developing an eating disorder and enhance self-acceptance, even if there are changes desired. Having a healthy body image can still enhance self-acceptance.
And I'm getting really excited about parts 2 and 3 as we go through this too, because we'll be talking more about self-acceptance later on in our later parts. And so please join us for that. Okay, so the weight dilemma. We have to talk about this, of course. It is so easy to get discouraged when stepping on a scale, particularly if you're exercising and you're accomplishing some of your fitness goals. Maybe you're even at the gym, even at UREC, right? And you're monitoring your weight and you notice that even as you're exercising, the number on the scale is not changing, or it's changing in a direction that you do not want it to go. Exercise has so many benefits that are independent from goals of weight loss, and the impact that that exercise might have on a person's weight or body size or shape. So focusing on the impact that exercise and fitness have on your body may also impact your enjoyment of exercising. We just encourage you to try to keep the two separate as much as possible to ensure maximum enjoyment. And I think I see a tail, which is making me very happy.
Don't apologize. We love a cat.
Yes, person after my own heart. Try to keep the two separate as much as possible, so that you can actually enjoy exercising and experience less self-criticism while you are trying to achieve your fitness goals. So shift from controlling your weight to focus on healthy behaviors, and healthy weight will follow. One thing that we talk about in therapy or counseling is this idea of radical acceptance, which means that radically accepting things as they are, regardless if two things seem to be oppositional. This is a key phrase that I use when practicing radical acceptance. I usually tell people, like, you can have both. And this is something that we want to encourage you to consider when it comes to any struggles with your weight. So again, if you're working towards personal fitness goals or eating goals, know that you can also experience self-acceptance while making changes. You get to have both. You can enjoy living your body and do things differently. And know
that, Crystal.
Good. Yes, I'm so glad. And because weight focus is so pervasive in our culture, like, it's understandable that we get those lines crossed very frequently. But again, just remember that the desire to lose weight or achieve different fitness goals and change your strength capacity does not have to mean that you have to have a poor body image. And I'll read this quote too. It says, "We are resilient, tough, and beautiful. We are complex, layered, and intricate. Our shapes, sizes, and differences make us unique." And I just think that's really beautiful.
Crystal, I see Taylor has a question, so I'd love to give him an opportunity to speak.
Please, that sounds great.
So it's not so much a question, but just to kind of speak on this. So I'm a female bodybuilder. And so a lot of the times people will be like, oh, that's so unfeminine of you. Like, that's kind of gross, you know. And obviously I'm at a point where, like, I can't really technically lose weight because so much of I'm kind of petite, but I also weigh like 188. So part of that is like separating, like, the way you feel is more important than like the weight on the scale, but also something that I always kind of took to heart because growing up being in fitness, I would say eat junk food, and then I'd be like, oh, I have to work this off at the gym later. So like one quote I found that like has spoken to me for years. It's like, don't treat the gym as a punishment, treat it as a celebration of what your body can do. You know, that's something that I've always just thought to myself. Even when I eat junk food to this day, I'm like, this isn't a punishment. This is me celebrating what I am capable of.
That is beautiful. Literally, I got chills while you were talking. Thank you so much for sharing that. I imagine that that's been quite a journey for you to, grapple with accepting your body, your weight, and also achieving your goals as a female bodybuilder. And you're also touching on like some of those like gender issues. Like, why do women have to just be like lightweight, and thin, or what, this is
right.
There's some of the ideals that we'll be talking about more too in part 2, because we recognize that like this impacts all of us. And I love that. I think that was a wonderful example. Thank you for sharing that.
Are you ready for the next slide, Crystal?
Sure. Yes, and please raise hands. I will be transparent and say that I was looking at that little blue hand and had no idea. I don't know why. It just did not click with me. So please continue to do that. We appreciate the feedback. Okay, and so with that, we've talked about kind of weight management or that weight dilemma. We'll also talk about surgical solutions. So that idea of radical acceptance, being able to have both or have all of the things, can also be applied to considerations about cosmetic or plastic surgery or certain enhancements that people might desire. You can develop a healthy body image and desire to make a change. We're not anti-surgery or anti-cosmetic procedures here. While cosmetic surgeries or procedures can improve the quality of life for some, though, we want to remind you that it may not actually improve the quality of life or the body image of all who partake, specifically if the motivation to make a change is deeply rooted in a negative body image. In those cases, unfortunately, that negative body image and those feelings of discontentment and distress, they usually persist even after making the surgical or cosmetic change. So we just want to remind you of that. Next slide, please.
Awesome. Okay, so we couldn't talk about some of the, challenges with body image without talking about the impact of COVID-19. And pretty much every time I see this image, I just chuckle and think about Crystal, and us talking about including this in our presentation, and how she's like, Barbie's so cute in both the before and after. And I love that embrace of we can love both of these things. But because of COVID, because of a different way of life right now, a lot of people have had disruptions to their routines, which includes their eating, cooking, exercise routines. I came across a really interesting example of this today. I was working with a client who is in an at-risk population, so they don't feel comfortable. They're scared going to the grocery store. So they're very limited to just ordering their groceries online. And when you think about like all the intricate and subtle ways this can have an impact on an individual, it's a little bit mind-blowing. So there's lots of changes that are happening, and there are also lots of things on social media, lots of comical things, and while some of them are humorous, there is a concern that I have about the weight focus. So, we've heard about the quarantine 15, or, making sure you don't gain the quarantine 15. And, for me as a dietitian, my biggest concern is that everyone is taking care of their basic needs, whatever that looks like right now. It might be a little bit different, and embracing that that's okay. But that can be super challenging for someone that's struggling with body image or disordered eating or eating disorders. There's also definitely, I've seen on social media, increased pressure to diet and exercise to avoid weight gain, or like, of course, if it's a good time for you to make a change, go for it. But, for some people, seeing other people experience, extra motivation might make them feel a little frustrated. And then another added layer is, with the change in schedules and how we're doing things, there might be an increased time for media consumption and self-reflection, maybe even particularly earlier in the pandemic. So for someone that is frequently comparing themselves on social media, that could be particularly challenging. And then we also can't go without mentioning this last bullet here, the increased time looking at ourselves due to virtual meetings and classes and Zoom and Teams. And I have never looked at myself on camera more than I have in the last 6 months. And for an individual that might be struggling with body image, that could be particularly triggering. So there are lots of intricate ways that COVID has had an impact, or has a potential to impact someone that's struggling with these issues. And we're not going to really dive into any solutions per se, but parts 2 and 3 will cover more tools to work towards improvement in those areas. Anything else to add here, Crystal, that I may have missed?
I mean, I think you did a great job. And, just to talk about Barbie yet again, I think what Emily's referring to, when I saw her, I said, you know what, she cute there, and she cute in the second one too. Like, I think that thin ideal is so pervasive, particularly for women, for individuals that identify as women, but really for all people. But I mean, we'll talk more about this, kind of embracing not only your own body as a tool on the path to greater acceptance, but also sort of diversifying what you see, and seeing like Barbie in a larger body, and how that can actually help us learn to accept other bodies around us, and sort of like contribute to this overarching idea of accepting bodies in general, So I think that's something that's really important. And I truly wish, they would have had a Barbie in a larger body size when I was younger. I might have felt like you know, I could relate a little bit more to Barbie, but she certainly did not look like me. So
Nor do we all have her perfectly arched foot.
no, true. I have flat feet too. It was really depressing. I actually didn't really play with Barbie, so that probably explains it. I could have a whole therapy session on that right now with my own therapist.
Another session.
Okay, so like Emily said, we really hope that you join us for parts 2 and 3. You know, we also recognize sort of that virtual or Zoom fatigue that all of us are really susceptible to. So we want to put this kind of in smaller bites if possible. So part 2, we will be talking about specific obstacles to body image and body image acceptance. We'll talk about identifying your obstacles and how to overcome some of them. And in part 3, we'll talk about really strengthening your body image and developing a healthier, more neutral or more positive body image for yourself by teaching some skills that can be helpful. We'll also be going more into depth into diet mentality and restriction, and that idea that Taylor brought up about sort of using the gym as a punishment or also using food as a punishment. And we'll talk more about our visual diets and media consumption as well and how that impacts us. So we do hope you join us for those parts. For next time, for part 2, which will be next Tuesday, at the same time, we ask that you reflect on the following questions. So we just want you to start to consider these things if you haven't already. Notice some of your strengths and vulnerabilities. So what are your complaints about your body or physical appearance? What specific situations cause you distress? These may be situations like being in public, around strangers, being around individuals of a certain gender, maybe either the same gender or a different gender than you, being in front of a mirror. What are those situations for you? How much are you invested in your appearance? I think I mentioned a little bit earlier that when we're experiencing severe body image distress, we may also put a greater weight on our physical appearance than we ought to. So how much of your energy is devoted to your physical appearance? How do you cope with being dissatisfied with your body? Are you turning to punishing behaviors? Restrictive behaviors? Does it affect your mood or your relationships? And how does your body image influence your life overall? And maybe your satisfaction, feelings of meaning and purpose and things like that. So there are no right or wrong answers to these questions. These are just prompts that we want you to think about as we go through this journey with you, and try to be honest with yourself as you start to practice some self-reflection. As you reflect, you might think about something that does cause you distress. If so, know that that is a normal part of this process, that when thinking about our bodies and our body image, particularly as we start to maybe dig a little more into the past, this may cause you some discomfort. If you need additional support to process that, please reach out to Emily or myself or to the Student Health Center. Utilize one of the resources that we'll have on the next couple of slides that you might be helpful to you, and get some support if needed. Next slide, please. And these are some of the self-assessments that Emily mentioned at the beginning of this presentation. So the first resource listed on the slide is MindWise Innovations. It's a self-screening tool that's on the Student Health Center's website, and you can complete it anonymously. You have the option to do a very generic assessment or to select specific issues that you might be facing and answer questions that are pertaining to those issues. MindWise will assess your answers and offer you suggestions on how you might choose to address those issues. And again, your responses are anonymous, so just try to be as honest as possible so that you can get the most helpful results and get connected with resources. The second bullet point, the Renfrew Center was the first residential eating disorder facility in the U.S. and has been treating eating disorders in adolescent girls and women since 1985. Aside from those treatment options that are available at their center and virtually, Renfrew also has some excellent online resources and educational materials. including interactive quizzes that are online, like, do you have a healthy relationship with food? And do I respect my body? So these are some self-assessments that you may consider taking just to sort of see where you are and where you're beginning on this journey with us. Next slide, please.
Okay, so some resources that we feel are relevant here. Obviously, the next two parts of this series, part 2 and 3, the Student Health Center website, which I will have on the next slide. And there's a picture here of the body image workbook. I know Crystal and I have both thumbed through it and utilized it and find it to be a really helpful tool, and might be something that you might want to work through with a clinician as well, but it is a really great resource. And then a few other websites here. I quoted Marcy Evans earlier, so she has some good resources on her site: the National Eating Disorder Association, the Body Positive website, and Dove Self-Esteem Project.
And like we mentioned, of course, if y'all have any questions after this, feel free to email us directly. But here is the contact